Our index case was a 15-year girl who presented with 6 months history of abdominal pain, diarrhea, and occasional hematochezia. She was becoming progressively pale over this period. Clinical examination revealed a grossly pale girl with no other physical findings. Laboratory tests revealed severe iron deficiency anemia and stool analysis showed ova of Trichuris dysentery. A diagnosis of inflammatory bowel disease with severe anemia was entertained. She was planned for parenteral iron therapy and a colonoscopic examination. Video colonoscopic examination revealed carpeting of the entire colonic mucosa with thousands and thousands of Trichuris dysentery worms. The thick posterior segment of the worms was visible as curved structures of 1 to 2 centimeters. The anterior narrowed end of the worm, namely the whip, was embedded in the mucosa. Associated mucosal changes included petechial lesions, blotchy mucosal hemorrhages, and active mucosal oozing. The mucosal hemorrhages were seen at sites where the worm's anterior end had burrowed into the mucosa. Mucosa showed edema at the sites of heavy infection, which caused a lack of distensibility and luminal narrowing. There was no mucosal friability, ulceration, cobblestoning, or polyps. These changes were well described in the still colonoscopic images as shown in this slide with 4 composite pictures. Colonoscopic forceps biopsy revealed posterior segment of a female adult Trichuris dysentery worm containing a gravid uterus with numerous Trichuris dysentery eggs. This forceps colonoscopic biopsy showed a gravid uterus of Trichuris dysentery worm loaded with characteristic eggs of the worm. Colonic mucosa showed increased lymphoplasmacytic infiltrate. There were no cryptitis, crypt abscesses, or mucosal ulcerations. Patient received parenteral iron therapy and effective antihelminthic therapy. She had rapid improvement in abdominal pain, diarrhea and hematochezia settled, and she showed improvement in her blood indices. A repeat colonoscopic examination at 6 weeks follow-up showed normal colonic mucosa, and repeat biopsies did not show any Trichuris dysentery worms or eggs. She stayed asymptomatic for 5 years in the follow-up. Our index case 2 was a 40-year female with iron deficiency anemia. She had Trichuris dysentery infection limited to the cecum and right colon. This video shows Trichuris dysentery worms actively moving in the cecum. The fact that anterior narrowed end of the worm, that is the whip, was embedded in the mucosa and could be extracted from the mucosa by holding and pulling on the posterior segment of the worm by forceps is shown in this video. Over a 3-year period, we detected 10 patients with Trichuris Dysentery Syndrome. All patients were adults and dominant presentation was progressive iron deficiency anemia. Worm invasion was limited to the right colon in 7 patients, ileum in 1 patient, left colon in 1 patient, and whole colon in 1 patient. Trichuris dysentery is a geohelminth inhabiting the human cecum and proximal large bowel. Over 1 billion persons harbor Trichuris dysentery infection, mostly in the preschool age children and school age children. The infection is mostly asymptomatic. There are few published case reports of Trichuris Dysentery Syndrome in children. The disease has not been reported in adults. Trichuris Dysentery Syndrome is caused when colonic mucosa is invaded by numerous worms. The disease causes mucoid diarrhea, rectal bleeding, rectal flaps, iron deficiency anemia, and finger clubbing. In addition, children with Trichuris Dysentery Syndrome may develop growth retardation and impaired mental development and cognitive functions. This presentation focuses on the fact that in endemic areas like Kashmir, Trichuris Dysentery Syndrome occurs in otherwise healthy adult population, Most of these patients present with iron deficiency anemia with minimal or no bowel symptoms. Colonoscopic findings are pathognomic as numerous organisms invade colonic mucosa regionally or all over. Trichuris Dysentery Syndrome should be considered in all patients in endemic areas with chronic iron deficiency anemia and or occult blood loss.